will worship you. I will worship you. You are greater. You are stronger. You are greater. You are strong.
Hello, welcome to another edition of the Inside View. Just like we do all the time, on the Inside View, we just educate, people, inform, and also empower people. I hope you've all had a wonderful, week. Thank God it's Friday, and I am super excited because tomorrow is Saturday, and then Sunday we can all rest. If you haven't actually been on my wall yet, we are talking about abnormal bleeding. So please take a minute of your time to invite a sister, and also ask that sister to also invite another sister, because I think it's high time we took charge of our own health issues as women. So please gather all your friends, your family, and then let's just listen to Dr. Zainab, who is going to give us first-hand information on this abnormal bleeding. So welcome, to the Inside View, Dr. Zainab Ganiyu-Dada.
Thank you for having me.
Yeah. So how have you been today?
Very well, yes. A little bit busy, but very well. Thank you.
Thank you so much for always, accepting to educate our women. And thank you so much. In spite of your busy schedule, you always make time to be a part of this program. Thank you so much.
My pleasure.
So let's go straight to the point. Doctor, what is dysfunctional uterine bleeding? What is it?
So a very brief description of that would be bleeding outside of a normal menstrual cycle. So this would occur in women who are of reproductive age, which could be anywhere from about 12, 13, when girls first start getting their periods, maybe a little bit earlier, all the way up to the menopause. So having a regular cyclic bleeding is normal. When you have bleeding outside of your normal cycle, we would refer to this as dysfunctional. So that would mean that there's no clear physiological reason as to why a person is bleeding. And it's more likely to be associated with a pathology, of which there are many.
Wow. So what are the medical conditions that often cause dysfunctional uterine bleeding?
So it's beyond the scope of this this talk that we're having for me to go into a lot of detail. But one thing I will say is that there's a series of common dysfunctional bleeding causes, and they will include probably most commonly fibroids. You can have hormonal changes, so that could be secondary to stress, contraceptives, pregnancy. You can also have polyps, which are small growths that can often occur in the female reproductive system. And you can also have trauma as well, as a result of which can cause dysfunctional uterine bleeding. So the scope and the cause for it is quite varied. So I'm hoping during this discussion, I'll be able to touch on in a bit more detail the different causes and the different things that we need to look out for that are worrying and things that will usually just settle.
Wonderful. As women, we tend to complain a lot. But, doctors don't, it takes a while for them to sort of refer us to the specialist. So for you, what are the barriers to seeking consultation for, this DUB that we are talking about today?
So within the diverse ethnic community, so we're thinking of Black and brown people for the most part. Sometimes there's a taboo within cultures about discussing these things outside of a family unit. Sometimes communication is a problem. So it might be a language barrier or not understanding fully what's wrong and assuming that it's normal when you don't understand what is normal. So I think one of the key things that will empower our community and the wider community would be people understanding their own bodies and understanding what is normal and what is definitely abnormal. That way, you can feel empowered with that information to then go to your doctor and say, look, this is not normal, and this is why I think it's not normal, rather than sitting on something for a long time to the point that it becomes intolerable, unbearable, too painful, etc., that you then feel desperate to go. So we should go as early as possible to find out what is wrong and to be able to understand what is wrong and what is normal.
Wow. So, my worry is, in the 21st century, we still, see menstruation as a form of taboo, like like in terms of talking about it to our
Mm.
young girls. What can we do, as women, how can we break this ice? Like in terms of knowing our body and also understanding our body, and also, feel I'm feeling so confident to talk about these issues with our children, especially our young girls.
So I think it's important to start early.
Mm-hmm.
So as children, as soon as your child starts to understand the world around them, it's important to normalize this part of physiology. Essentially, in the same way that we potty train our children and we don't associate any taboo with them pooing by themselves or weeing by themselves and not wetting the bed or wetting their underwear, and we see it as an achievement for them. We don't taboo using the toilet. If anything, we celebrate it when little children are able to have that level of independence. We should also encourage them to understand that as you get older, there is a part of your body that will start behaving in a way that is different to how it behaves now. So, in the same way, as you get older, you can hold in your wee and your poo, and you don't need nappies anymore. When you get older, there's a part of your body as a female that will change in a way that will help you know that you can then have children at a later stage in life. And I think when we normalize these things as a normal part of our development, that will help to break down the barriers rather than having, the secret stash of pads or tampons and things like this, making it a very, very normal thing. No one is, no one thinks it's strange to talk about toilet paper,
Mm-hmm.
or how we use the toilet when we're just trying to teach children how to use the toilet. All of these things are very normal. If you start children off early, they won't have a problem with this. They won't see it as shameful or weird because it's perfectly natural. It's as normal as going for a wee or a poo, but it happens less frequently, and it only happens to one portion of the population and not the other. And I think if we approach it with that manner, rather than something to be shy about, then we will start to be able to create an environment where men and women can discuss these things openly. Because you will have people who are single fathers, for example,
Mm-hmm.
or husbands who maybe didn't have sisters growing up, who want to know, these things before they get married, so that they're more aware, they're able to support their wife, etc. And I think there is no real reason as to why we can't be more conscious of these things, because it's perfectly natural and there's nothing weird or taboo or strange about it.
Wow. Do you know what? I'm so glad that you talked about, our culture, because I know in certain cultures it's even a taboo, to even talk about,
Mm,
like menstruation. And also, where even when women, actually menstruate, they are not even allowed, to cook. They are
mm,
not even allowed to, go to certain parts in the church. They are not allowed to do certain things because they are seen as unclean. How
mm.
can we break, this taboo? At what point can, our men understand how we feel about all these things? Because I think sometimes it's a bit difficult for us to, talk about this openly, about the way our bodies actually operate, as
Mm.
women. Yeah.
Yes, no, most definitely. I think some of the taboo is around misinformation
Mm-hmm.
and miscommunication. Some of it is deep rooted and needs to be challenged, because it essentially is putting women in a vulnerable and disadvantaged situation, whereby they are isolated socially, which is for the most part unacceptable, quite frankly. And a lot of people are holding on to traditions
Yeah.
that are not rooted in anything. And when they actually ask why they're doing this, it has a lot of the time no basis. From a religious perspective and otherwise, from a cultural perspective, when you actually look at the root cause as to why people end up thinking the way they do, it more often than not has nothing to do with religion. It's a misinterpretation of their own religion, or a extreme misinterpretation of their own culture. So it's about undoing and unpacking those things, and actually making an effort to seek out knowledge, rather than sitting and saying, okay, this is what my mother did, and my grandmother, and my uncles, and my aunts, and everyone, without challenging it or asking questions. No one's asking for a revolution. We're asking for, why is it that this is done this way? What is your reasoning? Why is it that we're put at a disadvantage? And more often than not, you will come out with, it's just what we do. And you would be surprised the amount of times that people don't understand why they do things and what it's rooted in. So,
Wow.
for example, in the Islamic tradition, there is an idea and a concept that some women are seen as unclean if they are bleeding, menstruating, any of those things. And in actual fact, that's not the case. The whole reason that we would be exempt from praying would be because it's a difficult time. It's physiologically draining. It's uncomfortable. It can be painful. So we're exempt from things like praying, because we need that time to be able to look after ourselves, take our time. And the same with fasting as well. It's not because we are somehow unclean and untouchable. It's that for us to fast in during that time would be detrimental to our health, because we wouldn't be able to get all the nutrients we need within us to withstand all the symptoms that we have associated with a bleeding for that period of time. So, if anything, it's a mercy. So, but a lot of people will see it as, no, I'm unclean. I cannot go here. I cannot do this. I cannot do that. And it's just simply not the case.
Wow. We are celebrating Black History Month, and
Mm.
there's a lot that we go through. So someone asked this question. She said, how should women talk to their healthcare providers in a way to ensure their concerns are not dismissed as typical period symptoms?
So again, it comes back to empowering women to understand their own bodies. You would be surprised how many women I've spoken to and had to do examinations on, etc., that are not very familiar with their own reproductive system. And I think that that's the first step to being able to say what is wrong. If you don't know what normal is, how will you know what abnormal is? So, in order to do that, you need to be able to understand what is normal for you and what is normal generally. So, the way that we would empower ourselves and allow us to be able to go to a healthcare professional and say, look, this isn't right, is that you would explain to them, look, this is what is normal. I understand what is normal. What is happening is not normal for me, and I am concerned. That should be enough for a competent and caring healthcare professional to want to ask more questions from you, to seek more information, and to, if needed, do further tests. If you're not getting that response from your healthcare professional, I would advise you speak to another, or you stress the point further. If you don't have the option of speaking to others, express the fact that you know what is normal for you, and this is clearly not normal. What a lot of women might do instead is say that they're in pain, or the bleeding is heavy, and they will be dismissed as saying, well, that's normal. Everyone needs extra pads sometimes, or everyone has a bit of pain. But if that pain means you're missing days of school, you're missing days of work, you're unable to leave your house without being in a constant pain, you can't function, that is not normal. That is never normal. And that is something that we need to understand. What we also need to understand is that bleeding through your underwear regularly and bleeding onto your sheets, etc., again, is not normal and should not be tolerated. This is something that needs an intervention and something that you will need support with. Never consider being difficult, having a difficulty being normal. If you are finding it difficult, more likely than not, it is abnormal.
Wow, thank you on that one. So, before we go into the specifics, if anyone is watching us and want to, actually send their comments, their questions, their concerns, please don't hesitate to do so, because that's what we are here for. And also, I would urge, anyone online to please invite as many women as possible for us to be educated, please. And I think the first one that we'll go into is the intermenstrual bleeding. What is the most common cause of the intermenstrual bleeding, Dr. Zainab?
So there are numerous causes. Things that tend to be quite common are hormonal imbalances. So a very obvious one that maybe some people might not be aware of is oral contraceptives, or contraceptives generally, actually. So there's many different types of contraceptives that we can have. So we can have a device called an interuterine device, whereby we insert a coil, which is a T-shaped device. So basically it looks like that and is inserted into the vagina and sits in the uterus. Some of them release a hormone, and that can cause bleeding between periods whilst things settle. You can also have the oral contraceptive, which again can have similar symptoms, and you can have a depot injection, whereby the hormones are injected into the muscle and are slow released over a number of months, and will then need another injection to follow up to maintain that contraceptive capabilities. So any imbalance in hormones can lead to bleeding between periods. Also, if someone is particularly stressed, if they lose a lot of weight, or if they gain a lot of weight, they can have bleeding between periods or irregular bleeding, which can also be defined as intermenstrual bleeding. If you're not quite sure where your cycle's beginning and ending, and you have erratic cycles that have suddenly started over a more acute period of time. So hormones would be the first one. You can also have problems with the uterine anatomy. So most commonly, that would be fibroids. So particularly large fibroids that respond to fluctuations in hormones, which is very normal, can cause bleeding at random times. They can also cause other types of bleeding, which we will discuss in further detail. And so we have fibroids, hormonal imbalances, and the anatomy of the reproductive system. So sometimes things with the external genitalia can cause intermenstrual bleeding. So any problems with the vulva, for example, so that's the outer part of the reproductive system that you can see when a woman's legs are open without having to use any special equipment. You can see that from the outside. Any abnormality there can cause bleeding at any time, and that can be classed as intermenstrual bleeding. Problems with the cervix as well can cause bleeding, and we'll discuss in a lot more detail what those problems can be. But as you can see, there's many different causes as to why you can have bleeding between periods, and it's not a one size fits all. It's not a case of I'm stressed, that's it, or it's my contraceptive, that's it. It can be a variety of different things, which is why it's important for you to know what's normal for you and to know what your situation is.
So, how can people tell the difference between breakthrough bleeding and a period?
Okay, so again, this comes down to, and you'll probably hear me repeating myself a lot, is understanding what is normal. So as women, we need to understand that we have a reproductive cycle. It's approximately 28 days long. So that's 4 weeks. And during this time, you will have different phases of this cycle. And at different points, you will have different levels of hormones. So the 4 hormones we typically talk about are LH, which is luteinizing hormone, FSH, which is follicular stimulating hormone, progesterone, and estrogen. So these 4 different hormones are at different levels throughout the cycle, and they will cause different things to happen. So, in terms of when we think about intermenstrual bleeding and knowing the difference between what is normal, so what is part of a normal cycle, and what isn't, is that we need to understand what happens at the beginning and end of our cycles and when the bleeding period would be. So, when we're talking about a normal cycle, days 1 to about 6 or 7 are the days of bleeding. So, day 1 is the first day of bleeding up to day 7, plus or minus a few days, is a typical beginning of a cycle. After that, bleeding stops, and then the hormone levels that were lower start to increase, and depending on the where in your cycle you are. So, for example, progesterone will start to go up, and then during that phase, midway through the cycle, you will have ovulation, which is typically between days 12 to 14 or 15, and this is the time that someone can get pregnant. During this time, you shouldn't have any bleeding up until day 1 again, so the end of the cycle. So you may have physiological changes. So you might have tender breasts, you might have some pain in your tummy, some contraction like pain. You may feel slightly irritable. You may become more hungry, more tired, more receptive to heat. So you might be a little bit warmer around that time.
Mm-hmm.
And then all the way up to day 28, there should be no bleeding. And then once you've got to day 28, day 1 will start again. And from days 1 to about day 7, you will have bleeding, and then 3 weeks of no bleeding. So once you know what your cycle is, it might not be 28 days. Some people, it might be 26, 25, 24, 30 days. What is normal for you, you understand that and you plot that in a calendar, you will immediately know when your bleeding days are due. So you will know if it's abnormal, so if there's a delay or if they start early. So if, for example, you had day 1 of bleeding and then you went up to day 7, if you started bleeding again at day 15 or 16, that would be abnormal for you. And the reasons for that, again, could be numerous. So you could have a fibroid, for example, and that can cause irregular bleeding. You could have a polyp, again, that can cause irregular bleeding. So that's one way to know the difference. In terms of what the bleeding looks like, that's less easy to determine, because it's not that the bleeding that you have normally at the beginning of your cycle would necessarily look fundamentally different to the bleeding that you have in between periods. It might be that the bleeding in between periods is lighter, which is quite common because the fluctuations in hormones are unlikely to be as big. But it could be that you have 1 or 2 days of heavy bleeding and then it goes to nothing or becomes very light. So just looking at the amount of bleeding will not give you very much information. What's more important is knowing what is normal for you and seeing what deviates from that normal. That's the most important thing.
Wow. So when should one worry about intermenstrual bleeding? At what point should one worry about it?
So generally, I would say any bleeding between periods should make someone aware that something might not be right. There
Okay.
is never normal intermenstrual bleeding. That's not a normal part of our physiology. If that is occurring, there is a reason for that. It may not be a malignant or pathological reason. It could be to do with diet, fluctuations in weight, stress, etc., that can cause that. But if you do have ongoing bleeding, between periods, that is usually something that you need to keep a close eye on and at least check in with your healthcare professional. Sometimes women can have intermenstrual bleeding that will happen once and then never happens again.
Okay. Mm-hmm.
And that usually is because of a hormone imbalance and a sort of outside of the equilibrium of what is normal for that woman. And sometimes as a one-off, it's nothing to worry about. If it consistently happens and you have other symptoms such as bloating, weight loss, feeling generally unwell, feeling fatigued, any of those things, then I would strongly recommend that you speak to your healthcare professional. But what I would say and what I upon is anything that you are worried about, you should seek help from a healthcare professional sooner rather than later. Let them be the ones to reassure you rather than you reassuring yourself.
Yes. Okay. Wow. So, can it, really affect fertility?
Yes, yes. So in the simplest and most ideal world, fertility would be very, very straightforward. So we have hormones, we have day 0 or day 1, and we have day 28. We ovulate in the middle of that, and if the sperm reaches the egg at that time, you're pregnant. But as we all know, that's not how life works. And when it's your time to be pregnant, you will be pregnant. It's God's will. So it can affect fertility, but it's not usually the intermenstrual bleeding that is a cause for concern in and of itself. It's the reasons as to why it's occurring that might be having an effect on fertility. So, great shifts in hormonal changes can be an indicator that there might be issues with your gonadal axis. So, our hormones are based on things in our head as well as things in our reproductive system, and they go in a cycle. And that's what predicts our fertility. So, our ability to ovulate and our ability to maintain a uterine lining that will maintain a pregnancy. So, in and of itself, intermenstrual bleeding is not an indicator of fertility, but it can be an indicator that there might be issues with fertility if you've been trying for a certain amount of time. So, again, fertility cannot be predicted if you've never tried to get pregnant, but it's something that you will find out is an issue if you are trying for a certain period of time. And it can be anything up to 6 months to a year before you get pregnant. It's not guaranteed, even with all the perfect scenarios in place. And again, that's another talk for another day as to why that can happen.
This is a very, very big medical term. It's Maharagia, and I don't know whether I pronounce it well. And intermenstrual
Menorrhagia?
bleeding. Yes, okay. Menorrhagia, okay. How did you say it? Sorry.
Is it menorrhagia? You said, sorry, you went
Yes.
silent for a second.
Yeah.
Yes.
So, so what is the difference between menorrhagia and intermenstrual bleeding? I mean, viewers watching me, pardon me, this is a medical term, and we all make mistakes. So, yeah.
No, of course, no, I understand. So, intermenstrual bleeding is bleeding between periods. Menorrhagia is the medical term for heavy bleeding. So that tends to refer to the bleeding that's associated with cyclic bleeding. So the bleeding that you would have at day 1 to day 7. So that's the beginning of our cycle. Should I put my hand here? So day 1 to day 7 of your cycle, a normal cycle, you can have something called menorrhagia. So you may not have bleeding outside of your cycle, but between days 1 to 7, the bleeding is very heavy and is difficult to manage.
Okay.
Sorry. And the reasons for that can be numerous. A very common reason for that is fibroids, and that's something that I will touch on in a bit more detail later on in this conversation with you, Nana. So menorrhagia is just a very long word for heavy menstrual bleeding, in short.
Okay, that's fine. So we've now got postmenopausal and also postcoital bleeding. I don't know how you want to take it. I don't know whether if you want to go into the specifics in terms of polycystic, or I don't know how you want to go about it. But if you want us to do the specifics in terms of the postmenopausal, bleeding and also postcoital bleeding, that's fine. But if you want to touch on, something like polycystic ovary, thing, or endometriosis, or any of the symptoms that really causes every bleeding, I'm okay with it, and I think viewers can also, just follow your lead as well. If not, that maybe we can talk about the postmenopausal, bleeding, if that's okay.
Yeah, of course. Yeah, we can talk about that. So, Out of all the types of bleeding, the one that would immediately cause concern is postmenopausal bleeding. So the four types of bleeding that we are talking about during this conversation are the intermenstrual bleeding, the heavy menstrual bleeding, menorrhagia, the postcoital bleeding, which is bleeding after intercourse, and the postmenopausal bleeding.
Yeah.
So, Nana, in terms of all of them, the one that would give the most concern would be the postmenopausal bleeding. That's not to say that the other ones cannot have significant problems associated with them, so that those ones could be an indicator of cancer, for example. But postmenopausal bleeding as a default is considered a possible cancer until we can prove otherwise. As medical professionals, any woman who is postmenopausal, so they have stopped bleeding for between 12 and 24 months, and there's been no bleeding in between, those are considered postmenopausal women. If they suddenly have bleeding after this time, immediately they will be seen within 2 weeks under the UK NHS system. So the 2 week wait is a cancer rule that we have. Any person that we suspect of cancer in any part of the body must be seen by a specialist within a 2 week maximum period of time. Doesn't mean it will take up to 2 weeks, but it should take no longer than 2 weeks. So any woman who's past the menopause and starts experiencing bleeding, she should be seen by a specialist by default. There are no ifs, buts, or maybes. Any woman that I was to see who told me that she was bleeding outside of outside of the menopause, so she's definitely postmenopausal, it would be cause for concern, and we would do a series of tests until we can prove that it is something not sinister. Again, it does not mean that it's cancer, but there is a significant possibility that it could be. So we need to do diagnostics early rather than late, and we certainly don't watch and wait. So causes of postmenopausal bleeding outside of a uterine cancer could be vaginal atrophy, for example. So as women go past the menopause, their hormone levels will drop because the reasons that they need those hormone level fluctuations are no longer there. So their egg reserves have gone down, their need to ovulate, etc., has reduced. And so as a result, the hormones that were once present at higher levels are no longer present. So these women will have a vaginal dryness. And that can sometimes be associated with bleeding when there's itching and irritability. And that can cause shrinking of the vaginal canal and make intercourse uncomfortable or difficult or impossible. So that can cause bleeding in and of itself. Beyond that, most other causes are something that typically needs specialist intervention, but it would not be up to the patient to decide that this is likely vaginal atrophy and there's a bit of dryness. I'm going to leave it alone and it should settle. It's something that we would investigate further. And once we're satisfied that that is the cause, then we would say, okay, see if symptoms change. If there's any change, come back to us, etc. But we would never do that in a primary care setting. You would have to be seen by a specialist in order to determine if that is the case.
Do you know what? There's a problem, when, our mothers, having difficulty telling us about, menstruation. In the same vein, when they get older, they also find it difficult to talk to us about the changes in their bodies, because I think a lot of people watching may find it difficult to ask their moms if maybe they might be experiencing, some of these things. You know what I mean? So, if anyone is watching us, I would just urge you, maybe from time to time, have this kind of conversation. Ask your mom whether maybe she's experiencing maybe bleeding, outside her menopause, because sometimes they might keep it to themselves, till it gets way out of hand. So if you're a young woman out there, please educate yourself to be able to educate your mom. If your mom does not know, like all these things, have this open discussion with her. Ask her whether maybe she experiences any changes in her body, because sometimes you find it a bit difficult to open up to us until it's too late. So please, if you're watching us, listen carefully to be able to ask your mom any of these questions. Yeah.
I 100% agree.
Yeah, yeah. I am so blown away by you saying that like it gets to a point where even having sex becomes difficult what time because of the dryness that they experience. So where would you put somebody that's actually had a hysterectomy but not necessarily got into that stage yet?
So a hysterectomy, did you say?
Yeah.
So depending on the reason for the hysterectomy, their risk of having reproductive cancer obviously is significantly reduced because the one of the organs associated with reproductive cancer has been removed. The vaginal bleeding then could more likely be due to anatomical reasons as opposed to the hormonal fluctuations, because the source of the bleeding has in and of itself been removed. So women with a uterus that's been removed, they may or may not have ovaries. And this is a very important distinction. If a woman has ovaries, they still have the ability to produce certain hormones. If a woman doesn't have ovaries, then her ability to produce hormones is not there in the same way. A lot of women who have hysterectomies, plus or minus oophorectomies or removal of the ovaries, will often go on HRT. HRT again is another complicated topic for another day altogether.
Yeah.
But what I would say is that there are many different reasons for a woman to be on HRT, and it's not always because of the menopause. It's far from it. But young women, for whatever reason, have had to have a hysterectomy, and it's not always due to cancer. Sometimes heavy bleeding, uncontrolled bleeding, a complicated birth, or pregnancy, whichever, can lead to the removal of the uterus as a emergency treatment to save a woman's life. So again, the exact cause will determine what we would do. So some women will have part of their uterus removed, some will have their complete uterus removed, some will have plus or minus ovaries. So I can't give a definitive answer as to what the bleeding would be or would not be caused by, but it depends on the individual and what organs they have left. And that would be a discussion that they would have to have with their gynecologist typically to make them aware of things to be concerned about and things for them to not worry about, and that can be treated with symptom management as opposed to invasive treatment, testing, etc.
Wow. So what are some of the treatment options for postmenopausal bleeding?
So rather than focusing on the treatment, I think an important distinction would be the causes. So the causes, again, as I said, can be numerous. So vaginal dryness is fairly common, and that can tend to cause smaller amounts of bleeding. You shouldn't have heavy bleeding associated with that. That might mean that there's a problem with the vaginal mucosa, as we call it. So the tissue that makes up the vaginal canal. That sometimes can mean that there's a abnormality within that area. So it might be dryness, it might be an abnormal growth of some sort. If it's just because of dryness, you can have topical creams. So an estrogen cream that you can put externally or a little bit internally, but not as a pessary or anything like that. Although you can do those things. So you can have very topical things like a gel. You can have pessaries that potentially are inserted. And you can have contraceptives, so an oral contraceptive, so the hormone replacement that can help with some of those symptoms. If the problem is related to the uterus itself, that is something that usually needs more radical intervention. And that usually would start with further investigation. So you would have some blood work done. So routine blood work would include a full blood count, checking your kidneys, your liver, and checking your hormonal profiles outside of your reproductive hormones. So within us, we have tons and tons of hormones. As men and women, we have a whole bunch of hormones that do a whole bunch of different things for us on a daily basis that keep our body in a state of equilibrium. So if we're shifting one way, our hormones will go up so that we can shift back, or our hormones will go back down if we start to shift this way so that we can shift that way. So we're a constant flux trying to maintain an equilibrium. So, for example, a a problem with hormonal levels that is unrelated to the reproductive system would be an abnormality in thyroid hormones. So having high levels of thyroid hormones or low levels of thyroid hormones can cause abnormal bleeding. Typically, that is in women of reproductive age, but it's not an impossibility outside of reproductive age, depending on what your other hormones are doing and how far postmenopausal you are. So it's not something that can completely be ruled out. So that would be something that would be treated with medication typically, depending on if it's hyperthyroidism or hypothyroidism. So that's a low underactive thyroid or an overactive thyroid. And so that's a non-cancerous treatment reason for post-menopausal bleeding. So we treat the cause of it rather than the symptom. There's not really a way to treat it without essentially having a hysterectomy, but we wouldn't advise such radical surgery if we didn't know what the cause was, because yes, it would fix the bleeding problem per se, but might not necessarily get to the root cause as to why the bleeding was there. And the removal of the uterus without further investigation might mask other problems, because you would no longer have that symptom of bleeding, but the pathology may still be present, and you may not have the same symptoms that will allow an easy diagnosis.
Wow. So how common is postmenopausal bleeding? How common is it? Is it really common, or
No, no, it's not extremely common, because the reasons associated with it are usually pathological. Having said that, it depends on the type of bleeding. So a little bit of spotting because of dryness. So that could be dryness externally or internally, so into the vaginal canal. That would make it a common occurrence, but that's not something related to the uterus per se. If we were talking about the uterus and the bleeding being of uterine origin, that is not common enough that we would ignore it. It's common enough that you will see it happen to people you know, and sometimes it will settle by itself. Sometimes it needs further investigation. I think an easier way to put it is that it's not rare. It's definitely not rare, but it's definitely not a common occurrence that we're referring lots and lots and lots of women who are postmenopausal with abnormal bleeding that would be typically heavy in nature. A reason as to why you might have postmenopausal bleeding that may be heavy is a sudden fluctuation in hormones. So your hormones are pretty silent, and then you have a sudden fluctuation in hormones and a sudden drop in hormones, and you may randomly ovulate. That's not outside the realm of possibility. So a woman who's gone through menopause may suddenly ovulate and has the ability to become pregnant.
whoa,
That's not impossible at all. That is completely possible.
really?
And yes, that's happened. That's happened to a few of my family members. My mother told me of a grandmother who had one of her children postmenopausally because she just randomly ovulated and she had a son, and that was it. So it's not impossible at all. But again, it's something for the healthcare professionals to rule out as a potential cause. And we must rule out a pathological cause, because it's not common enough that we can say that it's just a fall and rise in hormones and it's nothing to worry about.
Wow. The shock. Wow.
Yeah, it can happen.
Can you just imagine? You think, oh, you know what? I've got grandkids, and so like you finish them from nowhere, voila. There's
Yes,
something
yeah,
already in the band.
yes, it's very
Wow.
possible. Yeah.
Wow. Wow. Any other information that you want to add to this, postmenopausal, like bleeding, sorry, that people can, be educated on?
So just having a look through my notes, I think we've covered the vast majority with regards to postmenopausal bleeding, in terms of the hormonal fluctuations
Mm-hmm.
and the things that are concerning. I think the key point to get across is that if you're bleeding a year after you've had the menopause and you've confirmed you're definitely postmenopausal and you suddenly have bleeding, you must go to your doctor sooner rather than later. I
Mm-hmm.
think, in terms of the bottom line message that I want to get across to women, is that any postmenopausal bleeding is abnormal until we can prove that it is normal or a sporadic event. Well, not normal, but a sporadic event, and definitely not abnormal.
Okay, so if it's sporadic, they should still, see their, healthcare provider. What do you
100%. It's
say?
the one type of bleeding that on no occasion I would suggest someone watches and waits. If you've gone through the menopause and you suddenly start bleeding, you must go to your healthcare professional.
Wow. So do you like any treatment options available, or there are no treatment options, or in terms of management of it, any advice?
So again, it comes down to the causes. So even if someone is postmenopausal, so maybe I should define what postmenopausal is. So 1 year after your last period, if you've
Mm-hmm.
had a period and you've gone 1 year without any more periods, you're considered postmenopausal. If you have bleeding any time after that, that is postmenopausal bleeding. And that is irrespective of if you're on hormone replacement therapy, so HRT. If you're on HRT or you're not, and you bleed, you must seek further medical help, support, and advice. So, in terms of treatment for it, again, it's not treating the symptom, it's treating the cause. Postmenopausal bleeding is a symptom of a problem, and it's about finding out what that problem is and treating the problem rather than the symptom.
Symptoms, okay. If anyone is watching us and you want to join us live, yes, you can join me on the Inside View with Nana, or on my normal page, that is Nana Apena Oswahigan. That's my page as well, and also on my YouTube channel, the Inside View with Nana. So you can join us live on all these platforms. Yeah. All right. Thank you. Now we move on to the postcoital coital and bleeding. What causes bleeding after sex?
Again, oh, I don't know if you can see me. My computer's just done something
Oh yeah,
funny.
no, yeah, I can see you.
Okay, yeah, it's just me that can't see anyone. Okay, I'm back. Um, let me just, sorry, my computer's giving me messages. Okay, so with regards to postcoital bleeding, the causes again are numerous and they overlap. So, with regards to the four types of bleeding that we were talking about, so the
Mm-hmm.
intermenstrual, the heavy menstrual bleeding, the postcoital bleeding, and the postmenopausal bleeding, the causes can overlap between them. So each one doesn't have its own set of causes. You can have causes that can fit into any four of these categories.
Oh,
So
wow.
when it comes to postcoital bleeding, we can have something called an ectropion. So an ectropion is a abnormality on the cervix. And I think what I would like to show everyone, don't know if this is going to work. I was trying to play around with this and see. So, um, so let's see. Window, Chrome tab, share. Okay, so I'm hoping you can see that. Can you see that, Nana?
Yeah, yes, I can see that.
Okay, excellent. So the cervix is here. So
Mm-hmm.
the vaginal opening, if I just move this down slightly, this is the vaginal opening here. And this is the vaginal canal that I was discussing. Here is the cervix. The cervix is the bottom of the uterus. This whole area here is the uterus. The uterus is made up of different parts. So we have the endometrium, which is the inner part, and we have the myometrium, which is the more outer part. So this is a cut through section of the uterus. The uterus is obviously like a container. So this is a slice through it. So this myometrium is the muscle layer. The endometrium is what sheds every month and causes bleeding. And so that's this lining here. And that when that breaks down, the bleeding comes through here and through the vaginal canal and out into the external environment. With an ectropion, the cervix, which is this part here, can sometimes have an abnormality on it. So I'm just going to hope this works. As you can see, there's more than one type of ectropion. Okay, so I want a good picture for you guys. Okay, this is a perfect picture. So I'm hoping you can see this. Can you see this clearly, Nana?
See it.
Hi, Nana, can you see this?
Yes, I can. Yes, I can.
Excellent. Okay. So this is a normal cervix. So that image that I was showing you, this is front on. So when we insert a special device into the vagina, this is the head-on view that we will see as healthcare professionals. It's normal, it's donut shaped, and it's all one color with a little hole. And that little hole will lead up and into the uterus. An ectropion is where the endometrium extends out of the cervix. So the part that would normally bleed internally and would come out externally is now on the cervix here. And when that's touched by the penis or any foreign object, etc., it causes bleeding on contact. And a more significant ectropion is this one, which is much larger. Again, you as an individual will never be able to see this on your own body because we can't see our own cervixes because of how we're made. But this is basically what can cause bleeding. So if I go back to this picture, so that donut shape is what is here, but what we would see as healthcare professionals. And if you have anything that enters into the vaginal canal and touches this area, it can cause bleeding. Usually the bleeding is intermittent. So after intercourse, the bleeding will occur and then it will stop after a period of time. So if there's no further irritation or touching of the cervix, the bleeding will usually settle. If it doesn't settle, it generally means that there's likely to be a significant problem with the cervix or a problem with the endometrium here. So cervical cancer would be another thing that would be a more significant problem. However, you can have postcoital bleeding with cervical cancer that's intermittent. So you can have bleeding that stops and starts and can be an indicator of a cervical abnormality that requires certain intervention, which isn't an ectropion. So let me go back to stop sharing my screen. Okay, so yeah, it's a lot. So I wanted to show you guys what the cervix looks like because I think we need to step away from using cartoons. We use cartoons a lot and it's not always very helpful. The cartoon description of the reproductive system is better. The actual anatomy of that is just confusing for everyone. It's confusing to doctors sometimes if you don't know exactly what you're looking at and what it's connected to. So the picture is useful to get an overview. But the actual cervix, because that is what we see when we insert a speculum. So a speculum is a device that, so it's a plastic device that we would insert. So it gets inserted closed like this. So It's not the best description of it, but if you've ever had a cervical smear, or if you've ever been pregnant, you may have had a speculum used to look at the cervix. So it's a device that goes in, and once it's in the vaginal canal, it gets opened up so that you can see the cervical opening. And from there, it will give us an idea of the health of the cervix, and if the cervix is closed, so is a tight ball like that, or if it's open, so it will get wider and wider and wider. So we know in a non-pregnant woman, cervix should stay small. It might dilate slightly when there's bleeding and then closes back again. In a woman who's about to give birth, it goes as wide as 10 centimeters to get ready for baby's head to come out. So it goes from that to that, and it's all happening inside. You won't see, a woman can't stand there and you see the cervix. You have to use a device or your fingers to feel around for the cervix. It's not something that's external. It's very much internal. So going back to what I was saying, it's very, very important that we understand what that actually looks like.
So at what point does bleeding after sex needs medical treatment?
So I would say at any time, really. So again, I think the important thing to stress in this conversation is that there are potentially normal or physiological reasons as why you might have postcoital bleeding. But so it's not to alarm everyone that postcoital bleeding means that there's definitely a problem, but it can also be an indicator of an abnormality. So any persistent postcoital bleeding that you have is something that warrants further investigation, because as you can see, ectropions look very strange. So for someone who's not very familiar with the cervix, if you were to see that, you wouldn't be able to immediately say that's definitely an ectropion. What we might do is take a small biopsy, have a look at it under the microscope, and say, yep, that's an ectropion. Or very well-trained eyes who have been looking at ectropions for years and years and years will say that that's definitely an ectropion. Keep an eye on your symptoms. If anything changes, come back, we will reassess. But again, that's a decision for a healthcare professional to make and not for the patient. So it would be very rare that I would recommend, if ever, that someone considers postcoital bleeding as something normal and for them not to worry about. The healthcare professional that you see should tell you that it's normal. It's not something that you should reassure yourself with, even though there are very legitimate reasons as to why it can occur, and something that doesn't need to be worried about.
Okay. So, how long does it last? And, how do we stop, bleeding after sex?
So in terms of duration, as I was saying before, it can last a few hours afterwards, or maybe a day or two, depending on the size of the ectropion. As you can see, there's a massive variation. And that's if it's because of an ectropion. If it's because of a cervical abnormality like cervical cancer, it may go on for days or weeks even, because there's a pathology there, there's an abnormality. In terms of stopping the bleeding, again, it's going to what is causing the bleeding. So rather than treating the symptoms, we're treating the cause. So the cause of the ectropion is often hormonal and is related to the woman as well. So sometimes we can do things to remove the ectropion with a minor surgical intervention, and that can stop the bleeding if we're happy that it's just an ectropion. If we're worried that it's a cervical abnormality, again, sometimes we can remove that part of the abnormal cervix, and then there's no other issues, and that solves the problem. But again, we're fixing the problem and not the symptoms. If the symptoms persist despite some intervention, it may be that we need to look into further management options and further treatment options for that.
Wow. Our body is so complex, especially the women anatomy is all so complex. Wow.
Yes.
So is there anything that people can do at home to ease vaginal discomfort at home? Is there anything that if people
So again, it goes back to the cause. So I feel like I'm saying it a lot, but the cause of the discomfort is always the thing that we're treating. So we don't treat symptoms, we treat the root cause of the problem. So if there's vaginal dryness and it's related to coitus, so intercourse specifically, that may be because of a whole host of reasons. So if we've ruled out any pathological reason, sometimes there's something called vaginismus, which is an involuntary contracting of the uterus, which can be associated with pain. And if intercourse is attempted, can cause bleeding, discomfort, etc. Something that can help with vaginismus is using lubricants, which can make intercourse more comfortable and easier, which will in turn reduce the risk of bleeding, essentially, because you're lubricating that area. It will not fix vaginismus. Vaginismus tends to have, once it's diagnosed, it's a psychological problem that often needs different types of therapy in order to treat it, including talking therapy, couples therapy, understanding the root cause as to why vaginismus occurs, and exploring that further. So, but things to aid with that can be lubricants. If you're postmenopausal and the dryness is associated with fluctuations in hormones and it causes vaginal dryness irrespective of intercourse, you can use gels and pessaries that can be inserted or applied topically, which can ease some of the itching. There are also other causes that are unrelated to reproduction per se, so that are related to they're more related to the epithelia. So that's the tissue externally. So this wouldn't be a gynecological problem. This would be a dermatology problem. So the doctors of the skin. So people can sometimes get something called lichen sclerosis, whereby the vulva becomes irritated and chronically inflamed and can atrophy and shrink significantly to the point that the external genitalia becomes unrecognizable. So you will have the different external lips that are there, the inner and outer lip, so the labia majora and minora. And because of chronic inflammation, these can flatten to the point that the vaginal opening can become smaller and smoother. That's a very severe case, but that can happen, and that needs specialist dermatological intervention. So that wouldn't be a gynecological issue. Yes, it's relating to the vaginal opening and the external genitalia, but it's a dermatological issue that gets treated with topical creams, etc. And again, that's something slightly different. So there's a multitude of reasons as to why you can have vaginal bleeding, and the treatments for them, so vaginal dryness and subsequent bleeding, and the treatments for them are varied depending on the cause.
Wow, do you know what? I'm so happy that you mentioned lubricants. So with so many lubricants on the market, however, how do we know which one to choose? Any essential information for buying vaginal lubricants? The water-based or the oil-based. Which one do we go for? Any
So
tips?
typically water-based. Oil-based ones can affect contraception. So a diaphragm or a male condom, if you use an oil-based one, that can have an effect on the efficacy of them. A water-based one typically doesn't have those associated problems. So if you were trying to conceive and you're not using any of those barrier contraceptives that we call it, then you've probably got a bit more scope for it. But what I would say is it's trial and error. Make sure you're not allergic to any of the ingredients there, and see what it is that you need it for. So if you need it and you want to maintain contraception, then don't choose a lubricant that will compromise your barrier contraception. So typically an oil-based one will do that. A water-based one most likely will not. Ones with spermicide in them, for example, will obviously increase the contraceptive capabilities in addition to the barrier contraception. But as a general rule, I would say it's trial and error to kind of see what is best for you and what needs you're trying to meet. So reading the instructions and the information leaflets inside. If you really are stuck and you don't have a clue, I would recommend looking on your sexual health clinic websites and getting an idea from them as to the best kind of thing to use, or calling them or going in person and asking them for their advice, depending on what your specific situation is.
Wow. Any other information? Because we are getting to the end of our discussion, but I think we cannot end this discussion without not talking about endometriosis, because I think people see it as a silent killer. What do you say about, because a lot of people tend to have this issue, but most of the times it tends to be misdiagnosed or just not seen early. What can you say about that condition, and how can people talk to their health providers on this issue? Endometriosis,
So endometriosis is becoming more and more recognized of late compared to what it was in previous years or decades. Endometriosis, unfortunately, can take years to be diagnosed. A lot of women will see multiple healthcare practitioners before they're finally diagnosed with endometriosis. Endometriosis is one of a variety of different uterine abnormalities that can lead to heavy menstrual bleeding. Another one is called adenomyosis. Adenomyosis is something that may present similar to endometriosis, but is fundamentally different in terms of its location and how it behaves. So if I go back to my picture, so if I try and share that for you again to make that a bit easier. So, okay, so in adenomyosis, you would typically have a problem with the muscle layer, the myometrium of the cervix. Endometriosis relates to the endometrium. So the endometrium is this lining that we have here. Endometriosis is basically where this lining tends to deposit outside of the uterine cavity. So the uterine cavity is basically the space within the uterus. Outside of the uterus, we have various organs. So we have the bladder. It's not shown in this diagram. It's probably would make it too complicated, but we have the bladder, which would be around here. So the uterus is, it tilts backwards typically. So you would have the bladder here. You would have the gastrointestinal organs here. So you have your small bowel and large bowel, which will extend throughout here and will go further beyond this picture goes. And in addition to that, you will have other organs such as the fallopian tube, the ovaries, etc. So all of these are outside of the uterine cavity. You can have this endometrium, so this uterine, this part within the uterus, depositing on the ovaries, on the fallopian tubes, on the bladder, on the gastrointestinal system, and that can cause pain because essentially when there are fluctuations in hormones, you get the shedding of the uterine lining, so the endometrium, and that leaves the body here. But when it's within the body here, it has nowhere to leave. So that same pain and cramping, etc., that you have here, you will have here and here, further up into the body, up into the upper abdominal region even. Endometriosis can be very, very extensive. And the treatment for it is surgical. a definitive treatment is generally surgical. So I stop sharing again. So definitive treatment is usually surgical. However, surgical intervention comes with risks. Every time we do a surgical treatment, we create scars. So we do an ablation or burning, so to speak, of the endometrial areas. So the endometriosis areas that are external to the uterus, we'll burn them off and remove them, and that will help with symptoms. If we don't get all of the areas, or if those areas are not removed sufficiently, they can come back and cause pain again. If they are left untreated, you can end up with cysts and something called endometriomas, which can lead to chronic pain and adhesions. And what adhesions mean are when you have inflammation on one part of the body, and you've got another part of the body that's very close, they stick together. So every time we do surgery, when we heal, parts of the body will stick together. And that's just a general normal way of healing. So every time you go inside to treat endometriosis with keyhole surgery, which is typically what's done, and you burn those areas, you will have some scarring as it heals. And if you do that multiple times, you have more scarring. And as a result, you have risk of adhesions. And adhesions can lead to ongoing pain. And if you then go in and try and break those adhesions apart, you have the ongoing risk of scarring as well. So it can be a vicious cycle. So surgical treatment is a definitive treatment, but a supportive treatment can be hormonal therapy to prevent those fluctuations in hormones and prevent a regular cycle, and so remove the cyclical pain associated with endometriosis that often occurs as hormone levels fluctuate.
Wow. Wow. Any other information that you want to share with our viewers, because this is solely in your field, and you want to educate our women? So anything that you want to tell us tonight? Yes.
I think I've covered most things. I think the general important message I think to get across is that you need to know what is normal for you. You need to understand your anatomy and understand your physiology. So understand what normal female anatomy looks like internally and externally. I know we didn't really talk about external female genitalia, but quite frankly, just have a mirror, have a look, see what looks normal. A lot of the time, our partners will notice if something's wrong. So so slightly off topic, but if we talk about testicular cancer, it tends to be the partners of the men that will notice that something's wrong before the man notices. So again, with women, sometimes it might be that their partner notices something was wrong before the woman does. So being familiar with your external genitalia is very, very important. Being familiar with your internal reproductive organs is important, because then you will have a mental idea of what your body is doing and what is normal for you. And also following your reproductive cycle is very important, and is something that I would encourage women to do as a norm. Keep those dates in your calendar. Know what's normal for you. Are things getting shorter? Are things getting longer? Is the bleeding being longer or shorter? And understanding that. So understanding normal anatomy and physiology, understanding what is normal for you, and then you will immediately understand what becomes abnormal. And all of those things together will empower you to be able to have discussions with your family, with your friends, and will give you that confidence to go to a healthcare professional and explain what is wrong and what help you need from them.
Wow. Thank you so much. I wish we could just go on and on and on, but because of time, and I know you're so busy, so I think I will just let you go. And I was expecting, women to send in, their concerning, questions, but so far, it's just a few comments, very educative. And one said, "Good evening, Nana, and you and your crew. Thank you." Okay, says, "Good evening, Nana, and your crew. Thank you, Lord Jesus, for the gift of life. Thank you for everything. Yes. And I've got, Christine Ensign also saying very educative. Yeah, I know people will go back and watch it later on. Yes.
Mm-hmm.
So if you have any concerns, if you have any questions, please don't hesitate to, put it on the comment section. I will, definitely pass it on to Dr. Zainab, and I can assure you that she will send you all the answers that you would need. Yeah.
Most definitely.
Yes, and I've got another one from Amma saying very educative and informative as well. Yes, so thank you, and thank you so much, women. I think, just as I said, from the beginning, that it's high time we took charge of our own health issues, because that would really empower us, to be aware of our own bodies, because our body, as you all know, is very, very, very complex. Listening to Dr. Zainab tonight, I am blown away that our reproductive organ, it's so complex that still I still can't, process what, she's told us, tonight. I think I might have to go back and watch it again and be educated myself. Yes. Yes, with all the, I would say medical jargons, I would have to just go back and listen to this, myself. So thank you so much. Thank you so, so, so much.
My pleasure. My absolute pleasure.
Yes, thank you. And I hope you come back again and, still educate us on other topics that maybe you might need your help on. So thank you so much, and enjoy your weekend. And
thank you. You too.
God bless you. Yeah.
You too.
So thank you once again. Anyone, that joined us, thank you so much for your company, and enjoy your weekend. Thank you. Bye-bye.
Bye-bye.